when someone calls our office, we want them to understand who we are and that we're maybe a little bit different than the traditional dentist. We typically are trying to find out why they found us. We're trying to find out what their cosmetic interests are, and also if they've maybe found us because they're having headaches or neck aches or some kind of a jaw problem. And so from that perspective, we want to make sure that they understand what the kind of things that we offer and where we feel like we excel. And so that, together with really exceptional customer service, we try to draw those people in to our practice so that we feel like we can help them the most.
You feel like it's a family and that they really care, and they do.
One of the things that we like to do is to allow that person to choose what kind of services that they're looking for, because I can offer them general dentistry, basic dental health, which I've been doing my whole career, but I can also look at them as a cosmetic dentist, or I can also look at them as a neuromuscular or a functional dentist. And each person has specific things or reasons why they came to see me. And because I have all three of those areas that I can help them with, once I find out what's important to them and what their needs and wants are, then I can apply those necessary skills.
Dr. Brossoit is very dedicated, caring, thorough. He goes that extra mile to make sure everything is just perfect, wants you to feel good about how your teeth look and feel, extremely caring, bright, very personable.
Dr. Brossoit is a perfectionist, and so I knew I was going to be well taken care of, and it was terrific.
Well, I've seen people come in my practice and maybe they've been coming to see me for a long time, but it wasn't until maybe they saw what was possible. They saw some before and after pictures that we had either on our TV or a poster or something like that, where they were able to see and maybe envision for themselves what it might look like for them to have a new smile.
I didn't realize how terrible my teeth looked before. They were discolored and just small, ugly, and I looked pretty old. So I decided this is a thing for me.
The thing that I really have enjoyed the most for the people who really decided to do that for themselves and went ahead with that is to actually see the transformation in their life and then bring the person inside out that was kind of hiding behind maybe a smile that didn't look so good.
Wow. Just wow. The difference was, I just seemed to have a glow. Just a glow. It just was overwhelming because I look so much better and younger, and I've been told I look so much younger. So, hey, that's all it takes.
Because I had the problem with grinding my teeth, I chipped them up. It kind of looked like I'd been probably a boxer or something like that. They were in pretty bad shape and certainly much smaller. And because of that, I had, you know, once in a while I would get headaches and tension headaches and soreness in the jaw because I just constantly was working on my teeth, just grinding them and grinding them. And since I've had this done with Dr. Brossoit, I haven't ground my teeth at all.
Maybe they've come to me from a pain aspect, and they realize that, well, I can help them with their pain issues and headache, neck aches, and jaw popping and clicking, but realize that in the course of me taking care of their jaw problems, that it might be kind of a side benefit to have a new smile. Well, that's sure a win for everybody. I mean, they sure get to have a much comfortable life, not having the pain and the popping and the clicking and the headaches, but now they get to have a great smile too. I mean, what a great bonus is that?
I finally was fortunate enough to go see Dr. Brossoit, and the dentist that I've been seeing for a handful of years admitted that it's probably something that a neuromuscular dentist should take a look at. And so he, out of respect for himself and Dr. Brossoit, sent me over to his office, and fortunately I have a new smile, not because I needed necessarily to have a new smile, but because I needed to not grind my teeth anymore, and so I have found that place, thankfully.
I was really impressed with Doug Dr. Brossoit, the way he handled himself and the knowledge that he had in demonstrating what he'd been doing. And so I asked him if he would consider doing my mouth, because I was having a problem clenching my teeth.
We're basically looking at you from a broader perspective. We're looking at you from maybe some posture issues. We might be looking at what might be happening with your teeth, with your gums. Is there anything going on with your bite? Are there any kind of concerns with your symptoms as far as head, neck, shoulder muscles, ear symptoms, those kind of things? Because again, it's helping us to understand you as a person and helping us to take care of you in a much more profound way.
In the traditional way we used to treat cases like this was to use what they call border positions, where we would move the jaw to the position that the dentist thought was right because it was reproducible, and then build the mouth from there. And LVI's approach is to locate the position of the jaw neuromuscularly, using various forms of electronic equipment to help relax your muscles, and then let the patient locate the right position for his or her bite by themselves.
From a neuromuscular perspective, we're taking the jaw joints and the chewing muscles and the bite and looking at them all as a triangle. And we have to make sure that all three areas are working in comfort and in harmony, not just looking at one or two areas and getting focused on those. It's when we're looking at all three areas at the same time and getting them very balanced, that's when we see some amazing results.
When I was in 5th grade, I fell out of a tree and lost my front tooth. So all through my life, I have had a bridge or a fake tooth in front. And Doug has been my dentist, well, for over 20 years. And he's always helped, try and make it look as best he could. But he gave me the opportunity to actually go with him to Las Vegas, to the Institute of Dentistry down there. And so we took a trip down there, and in a room full of other dentists and patients, he performed this miracle on my teeth.
It's been really nice to see them kind of come out of their shell and be much happier and more open. And of course the stories that they tell us after they've got this new smile are just incredible. And a lot of the comments that we hear are, can't believe how better I feel about myself, and I'm smiling all the time, and I get great comments. So it's been a lot of fun to do that and see people's real, true personality come out.
It just totally changed. It was such an amazing feeling to be able to smile. I used to kind of not smile very big because you could see kind of the top of my teeth, and it was just an amazing change, transformation for me and my family. He did just such an incredible job, and it just really changed my life.